Hi, my name is Ben, and today we're going to talk about how to diagnose arthritis in the hip. Hip inflammation disease may be a common condition that causes issues with the ball and joint socket at the junction of the pelvis and lower extremity. Once inflammatory disease happens, the conventional joint becomes inflamed and painful. Do not be worried. We tend to shortly speak on the symptom on how to diagnose arthritis in the hip in this article. In any case, there are a wide range of sorts of joint pain that can cause torment in hip joint. For example, rheumatoid joint pain and different kinds of immune system spondyloarthropathies. While a portion of the conditions we have may be specific sublittles to their medications, a significant number of standards of treatment are the same on how to diagnose arthritis in the hip. Hip joint manifestations will generally advance as the condition declines. What is fascinating about joint hip inflammation is the side effects don't generally advance consistently with time. Frequently, patients report great months and awful months and indication changes with climate changes. This is crucial to comprehend because the contrasting manifestations of hip joint inflammation on the specific day may not precisely speak to the general movement or condition, and this is motivation behind why you should pursue further in this article on how to diagnose arthritis in the hip without mixing it up. Here are some of the well-known side effects of this kind of a situation. The first one, pain with exercise. The second, limited scope of movement. The third, stiffness of the hip. Fourth, walking with a limp. The fifth, pain in the crotch, thigh, or knee. Now let's talk about diagnosis. If your hip agony hasn't enhanced the following 2 weeks, you should seek a specialist. Don't forget that we are talking about is how to diagnose arthritis in the hip, and see your doctor about the pain in your hip to help on how to diagnose arthritis in the hip. In any case, it's smart to make a few notes about your condition before you go, so that you can make sure to examine everything that is troubling you. Your doctor will get some information about your torment and what developments exacerbated feel. They'll ask you what your side effects are and when they began, how they influence your day-to-day activities and exercises, and whether your agony is around evening time. This is all to know accurate way on how to diagnose arthritis in the hip. Pain when you twist your hip going up or down the stairs, or when you put on your socks, is a regular indication of hip issue, and this will, as a rule, give them enough data to design your treatment. In any case, you may require different tests to analyze a few conditions. So what tests are there? X-rays are often the best way on how to diagnose arthritis in the hip, as they demonstrate the state of the bones. They may likewise indicate issues in your pelvis, which could clarify your torment. These are not as helpful as taking a gander at the delicate tissue around the joint. The next one is CT scans. A CT scan can often be helpful on how to diagnose arthritis in a hip, as it will generally work out if the hip joint has a bizarre shape. CT checks use X-rays to demonstrate segments or cuts of the hip, which a computer at that point assemble the shape 3D picture of the hip. There are conditions where the attachment of the hip can be extremely shallow, and the CT will sweep and can show this. The next one is MRI scans. MRI scans use radio waves to create an image to point out what's happening on the soft tissue, like the muscles and the tendons within your hip. They're particularly helpful in how to diagnose arthritis in the hip, as they utilize to analyze the difficult condition of vascular corruption, which decreases the stream of blood to the finishes of bone, making them break down. Another one is blood tests. If your doctor thinks the torment is brought on by a disease or rheumatoid joint inflammation, blood tests can frequently help on how to diagnose arthritis in the hip. Another thing that you may want to look at after you get the diagnosis is some kind of pain treatment. A good resource for that could be a blog. HealthMate Forever, which is the leading manufacturer of TENS and PMS units, which provide stimulation to the muscles and areas that are inflamed, could be a great option to look at helping relieve some of this pain. They offer a wide variety of products that can help in your everyday use of trying to relieve some of this pain, and are definitely worth checking out. Now, as I mentioned, these are just a few ways on how they diagnose arthritis in the hip. You may have to do some more in-depth options, but you leave that up to your medical professional. If you'd like any information on anything we talked about today, check out the links below. If you have any questions, comments, or concerns, please let us know, and thank you for watching.